Hello, Sam here. All right. Here's another complaint for the day. I am on disability because, one, I'm crazy. Well, I guess that's really the only one. I was crazy before, but I'm especially crazy since Logan died. Hello?
Your student loan pre-qualification. You've been pre-approved for a lower monthly payment and possibly loan forgiveness on your student loan.
Really?
There are numerous.
Okay, first off, my parents paid for me to go to college. I've never had a student loan. And if these people don't quit calling me about student loans, sometimes 4 and 5 times a day, I'm going to lose my fucking shit. Anyway, so the government and I both decided it's just better if Sam doesn't work, because me working is going to lead to an anesthesiologist getting stabbed in the face with a pen. So all the anesthesiologists out there and the surgeons with attitudes should be grateful. Anyway, so I have Medicare. The way it works, my husband is employed. So therefore, my Medicare, I think it's like, and because I'm not 65 or some shit like that, is secondary. It's secondary. My Blue Cross Blue Shield through my husband's employer is my primary insurance. And then after that, my Medicare is my secondary insurance. This is the way the system has worked. This is the way the system has always fucking worked. Yet every year, Blue Cross Blue Shield starts denying claims, saying, my Medicare is primary. You know, there's 1,000 people probably, I don't know, 500, 1,000 people, a lot of people at my husband's company. And the Blue Cross insurance is through his company. So it's not like them bitches don't know my husband's got a job. And so they know my husband is employed. They know my age. They know they are primary. So I went and had my kidney surgery. What the fuck is going on with the color on my thing here? I had my kidney surgery. And now I'm getting calls. Here it is, whatever, 2-3 weeks later. Blue Cross is denying all these claims. I mean, it's what? It's like May 8th, 9th, something, shit, I don't know. But anyway, so it's not like I use a lot of fucking health care, because I hadn't gone to the doctor until, you know, it's almost June, halfway through the year, and I'm just now like using insurance and na. Anyway, and even with my Blue Cross and my Medicare, which I have to pay like $300 and some a month for that goddamn Medicare through to have the Part A and Part B, which I think is fucking crazy. But anyway, you know, you have one major surgery in the United States, and or not even a major surgery, but just kidney surgery. And that's made up for what my share would be on Blue Cross. I mean, my Blue Cross, we've got, I don't know, like a fucking $2 or $3 or some $1,000 deductible before they even start paying. And then they only pay 80%. I mean, so what if, which ain't fucking right. It just ain't right. So that means even if I only have Blue Cross, you know, I got to pay thousands upon thousands of dollars. You know, every time I go to the ER, it's $1,000 deductible. So if something happens and I go to the ER, Well, like I did after my fucking kidney surgery. When I think I had a stomach bug or something, and I thought I was fucking dying from a small bowel obstruction or some fucked up shit. So I went ahead and went to the ER. Well, that is $1,000 deductible right off the bat. And then after that, they only pay 80%. So, I mean, I had a CAT scan and shit with contrast. That's probably $5,000 or $6,000 right there. So what is my $1,000 deductible and my 20% going to be? A fuckload. A fuckload. And that's with my husband working 1,000,000 hours a goddamn week. You know, for a fairly large company with Blue Cross Blue Shield insurance. And just for me and him on the insurance, we pay, fuck, I don't know where Ernie keeps up with all this shit, but it's a lot. I mean, it's like, you know, $100 a week. A little bit more, a little bit less, something like that. So we pay $400 a month to have insurance just for the two of us. But then if I go to the ER, I still have $1,000 deductible plus 20%. Thank you, Obamacare, for fucking up everybody's insurance, because our insurance was never like this before, with these big fat fucking copayments and deductibles and all that shit. So I know somehow Obamacare's linked in with that, because that's when everybody's insurance went to shit. So, anyway, my point being, Blue Cross Blue Shield, this is their goddamn job. Their fucking mission, 8 hours a day, 5 days a week. This is their job. And they don't know, and they do know. What kills me, it's the same fucking insurance I had last year. Same insurance I had the year before. They fucking know my Medicare is secondary. But now they're denying all these claims, which means now I got to deal with all the fucking shit, and God knows Sam don't deal with shit well, of trying to get them to fix their shit. And then the lady on the phone, which she was really polite, but the lady on the phone was like, well, regardless if Medicare is your primary or not, we can't pay our part until we get the, and it's like the explanation of benefits, the EOB, but I think she might have called it something else. So I guess it's whatever the insurances do between each other. Of what they paid. And I'm like, honey, how are you supposed to get that when you're a primary? They're not going to pay shit until you pay. So how are you supposed to get anything from them saying what they paid? If you haven't paid yet, you're the one that's got to pay and then send that paper to Medicare, and then Medicare can pay. Thank God I'm fucking crazy and got Medicare, because if I didn't, and we had to pay this $1,000 deductible plus 20% for surgery. $1,000 deductible plus 20% the next day when I was in the ER at fucking death's door, sick as fuck. You know, but I knew I needed a CAT scan because I thought I had a small bowel obstruction, and where else am I going to get a fucking CAT scan but the ER? So it's not like I could just stop by a patient first. I had to go to the ER. And I'm sorry, but I swear I know CAT scans a long time ago used to cost like, I mean, $600 or $700. Maybe if you had contrast, they'd be $1,200 or $1,400. But the CAT scans now with contrast are like $6,000 or $7,000. I was like, holy fuck, that's fucking crazy for something that takes 10 fucking minutes. You know, they start an IV with a little bag of saline, and they give you some dye, shove it in the machine, pull you out, you're done. You know, oh, and that's not counting. Then they got some fucking radiologist has got to read it, and that's a whole separate bill. You know, none of these bills can be compiled into one. So then you got the radiology bill, because he wants, you know, $600 for taking 4 minutes to look at your CAT scan, and then taking 2 minutes to dictate something for somebody to transcribe, Anyway, I mean, I know we got good health care in this country, and I'm glad we've got good health care in this country. But it leaves a lot of people out of the loop. You know, my son is sick. He works every fucking day, and he has fucking Lyme disease from a tick bite, which I'm sure he got at work. And, you know, and he can't afford to see the gastroenterologist. And, I mean, he's very sick. He eats, he throws up. This is basically every day. His liver hurts. He's sick. And he'll get symptomatic and can't go to the gastroenterologist because the gastroenterologist won't see him because he still owes $600 from the last time. You know, he's trying to pay, but, you know, when these bills go into 5 different doctors, plus the hospital, plus the this, you know, when you're trying to make little payments to everybody. Well, then 4 or 5 months later, when he gets sick and needs to see one of those doctors, they don't want to fucking see him. And so where does that leave my son with health care? My son would be better off with mediocre health care if he could just get a doctor to see him. And then people complain about, you know, trying to cut Medicaid. Medicaid is like the golden motherfucking ticket in this country. If you have Medicaid, that's it. I mean, they pay for everything. They pay 100%. There's no copayments. You know, there's never a question about any of this shit getting paid. And they go to the ER. Well, not they, all of them, but a lot of them. They just go. And they use up all this Medicaid. And they take an ambulance, which is $1,000, $2,000 to get there because they twisted their ankle. You know, over anything, because they don't care. They're not going to get a bill. You know, if your neighbor drives you to the doctor, you have the nurse sign the paper. When I worked in outpatient surgery, I used to sign them all the time. And they pay like 52 or 54 cents a mile. So you can like either cover your gas if you have a car or pay your neighbor for bringing you or, you know, whatever. If one of your kids is in the hospital, they'll pay for your hotel. So you can stay near your child at the hospital. They'll pay for your meals while you're at the hospital. You know, and then my son that's worked his entire life, which, I mean, he's only getting ready to turn 29, but still, he's worked. He's always worked. And he can't get decent health care because he can't pay all this shit. You know, if he quit his fucking job and got on Medicaid, then he could get health care. But because he tries to support his children and, you know, make his own way in life, he's just, sorry, buddy, you're out of fucking luck because you're in the States. I mean, I don't want health care where we all have to wait 6 goddamn years for an MRI. I'm not saying that. But there's got to be some kind of balance. You know, there's just got to be some kind of balance that somebody can get sick and be able to go see the fucking, well, it's not immunologist. Well, maybe it is. The one that Andy sees about is Lyme disease. I mean, infectious disease doctor. That's what she is. I mean, she's wonderful. So he ought to be able to see her every 3 or 4 months if he needs to. So that's it for right now. Y'all have a good day.